The early symptoms of carbon monoxide poisoning are a bit like having a really nasty bug. The most important, the most common one is headache, but you can also feel sick, be a little bit confused, be a little bit breathless, maybe feel dizzy, feel generally very, very tired. It's very much like having a nasty bout of flu. If carbon monoxide poisoning is more serious, then you get all the same symptoms, but they become more serious. In particular, you can get very agitated, you can get very confused, your mind slows down. But you can also develop other symptoms, including seizures, unconsciousness, and tragically, even death. One of the big problems that we have with carbon monoxide is that people don't understand because people don't hear about it. And I think that one of the reasons people don't hear about it is that the figures are hugely, I suspect, underestimated. If you look in the UK, the official figures are 200 people treated in hospital for carbon monoxide poisoning and 50 people who die as a result every year. If you look at countries like the USA, where they're much more aware of it and therefore they're more likely to test if you go into hospital feeling generally unwell, feeling very headachy, feeling very weak, then you are much, much more likely to be tested. And they reckon there are about 15,000 people every year treated in A&E. If we knew it was a problem, we would be more aware of it. It would be higher up on our agenda. And I think what we need to do is to make people realise that it is a very real threat. As a doctor, I don't just make people better. A large part of my job is stopping them from getting ill in the first place. Whether it's working with parents to help them understand their anxieties and the pros and cons of immunisation, or helping older patients to reduce their risk of diabetes, heart disease, cancer. So it's enormously important to me as a doctor that if I can take part in anything that could stop people getting ill, and equally important, or even more importantly, stop people from dying, I want to. So I was delighted to be a part of any campaign that raised awareness about carbon monoxide and its risks. Carbon monoxide can hurt and it can kill. You can't smell it, you can't taste it, you can't see it. But it's preventable. You don't need to become a victim of carbon monoxide poisoning. Do take simple precautions. Make sure that any appliances you've got are fitted by a properly qualified engineer and checked regularly. Make sure that if you see black sooty marks, you know what to do. Make sure you get and have fitted properly a carbon monoxide monitor, and you know what to do if that monitor goes off. It's not an ornament. It could save your life.